If you had a shoulder surgery, but your neck is having pain while you're rehabbing your shoulder, here's what you might be doing wrong. So I'm currently treating a patient who had a rotator cuff surgery and is coming in to see us complaining of neck problems. Here's what we kind of diagnosed. And what I came to find out that, and it's typical if you, for you to have neck problem if you had shoulder injuries or shoulder surgery. Because when you have a shoulder surgery, your neck tends to pick up a lot of the load that your shoulder tends to usually do. But because of the surgery, it's unable to do all the stuff that you used to be able to do. And as a result, your neck has to pick up all the things that you used the shoulder for. And typically you'll be kind of put in a sling for quite some time till the strap on your neck it's going to put some pressure. The strap on the strap for the shoulder, the sling for the shoulder that's wrapped around your neck is going to put some pressure on your neck on the other side. And that pressure creates an imbalance. However, for him, he was doing an exercise wrong. So we had shown him an exercise. An exercise we were showing him was what we call shoulder abduction. And here's what we had him do. So we had him lie down and we had him lift his shoulders up as far as he can and then slowly bring it back down. That exercise, we increased the weight on him. And the next day he came in and told me that his neck was bothering him. And we found out that he was using his neck to do the exercise as opposed to using his shoulder to work out. And that's what caused his neck pain. And we had to cue his shoulder to make sure that the neck muscles are quiet and that the shoulder muscle is where we want to engage. So we need to kind of loosen up the neck first and then work on the shoulder to get them moving in the right direction. So that's very common. That's a very common thing that most patients are gonna want to use their neck anytime they engage the shoulder. That's a very common thing because they're compensating, and rightfully so, after their surgery. So that's a very common compensatory behavior that we're expecting someone with a shoulder surgery to do. What we need to do is to cue and teach the patient on how to avoid using the neck muscles and start engaging the shoulder muscles.